Hi, my name's Noel, I'm a psychotherapist. Welcome to this video today, which is about obsessive compulsive disorder, how to spot it, some of the things you might want to do about it, and some of the things that you can do with a therapist. That's generally what this video is going to cover. It's quite a complex subject, so I've got a lot of notes, so bear with me, I'll jump in and out of my notes. I hope that's not too distracting, but I want to give you something that's useful today and helpful, and let me know if it is at the end of the video. Leave some comments, I'd be great to hear from you. So what is OCD? Obsessive Compulsive Disorder is, I guess we can all have those traits when we're very anxious, and that's the key thing, is that it comes from anxiety and fear of something, either a specific thing or a general free-floating sense of anxiety. And as with most anxiety issues, it's about how we respond to that, sort of whether we reinforce it with behaviours and thoughts, or we challenge it. That is the key thing. It should be said that there is some research, I mean it's not conclusive, but there's a little bit of research which is suggesting that those that have OCD may have a predisposition towards developing the sort of more serious forms of it. So what's the difference between sort of just being a little bit compulsive about cleaning, for example, because you've got an exam in a couple of weeks' time, and something that's getting in the way of your life? And I guess the key is that it's something that's getting in the way of your life, and being open to people feeding back to you and saying this has become a problem. So what does it practically look like? I mean, the way it manifests behaviourally, if you think about it, are sort of people might count things obsessively or separate out colours. And it should be sort of understood that this sort of compulsive behaviour can also be part of other disorders such as autism, for example. And actually these types of ritualised behaviours are function in the same way in autism as it does in OCD. It's an attempt to control anxiety or feelings of fear. OCD is reacting to anxiety as though there is a genuine threat to self. And it produces a deep sense of fear that something really, really dreadful is going to happen. So one way of managing it for somebody with OCD is counting. Another is to clean obsessively and constantly, or it may manifest as checking things, unable to leave the house because you have to go back and check things over and over again, and things that you've already checked 5, 6, 7, 8, 9, 10 times. And we can all go back sometimes. I do it myself just to make sure that I've locked a door. But if you're going back again and again, it's become a problem. Or it may be doubting that, doubters, people who doubt the sort of social situations, the dinner that's happening, and are really, really anxious about whether everything's perfect, or the outing with family and friends, and really questioning everything about these social engagements that they're involved in, to the point where they're genuinely upset and upsetting people around them. Or hoarding is another typical form of behaviour around OCD. So the counting, the cleaning, the checking, the doubting and the hoarding, to quite an extreme level. The thing about OCD is it develops over time. And it may be that initially it isn't so serious, or you don't notice it just looks like normal behaviour, because any one of us can do any of these things if we're under some stress, for example. But it becomes a problem because it begins to interfere with the ability of the individual to function normally, and it's upsetting to people around them. And it's key to look at that, look at sort of the impact it's having on your ability to get on with your day-to-day tasks, and the impact it's having on the people around you. I'm not going to go into some, there's a lot of notes here I have that will be on the website and underneath the video to look at some things that you can do. I want to jump really to thinking about what are the general things that we can all do, and in particular that people with obsessive compulsive disorder can do in terms of trying to reduce fear and anxiety and reduce some of the behaviours and get back into a healthier way of relating to everyday life and to the people around us. No big surprises. It's a similar theme in many of my videos about anxiety and or depression. Is that there are certain key things that we can do that will reduce these types of, if you like, antisocial and unhelpful behaviours. These are maladaptive defences, as we call them. One thing is to think about your self-care, really, and really invest in your self-care. So rather than trying to deal with the problem, deal with the solution, if you like. Bring the solution into your life. So thinking about things like mindfulness. Mindfulness is an extremely helpful and beneficial activity to get into. It's a form of meditation. Check out the link that I put there on sort of my explanation of how mindfulness works. There's another video there. Exercise is really, really helpful at reducing stress and anxiety, and reducing the sense of stress and anxiety reduces the triggers to want to act out on the OCD behaviours. Getting into nature or your local park as often as possible. Again, nature is a well-known stress reducer, and again, reducing stress will reduce the triggers. Learning relaxation techniques, in making yourself stay connected to people and not isolating because of your fears. Getting enough sleep. Looking at whether there is any past trauma in your life and getting help for that, which may have triggered an OCD episode. So those are some of the thoughts about sort of self-care things that you can do. Specifically around the rituals, this is tip number 2, look at how you manage those rituals and reduce them over a period of time. So one thing that may seem counterintuitive to you is don't avoid your fears. By avoiding fears, we effectively tell ourselves that they're real. By facing our fears, we tell ourselves that they're not real. And remember that the point about OCD is it's reacting to something as though it is a genuine fight or flight situation, that it's a genuine risk to our lives, when in fact it's not. So if we face that fear, whatever it is, we reduce our sense of that anxiety about it. It may be scary at first, but it's really important to think about that, how we approach compassionately those things which we are afraid of. We call it exposure therapy in cognitive behavioural therapy. Refocusing your attention away from the obsessive, looking at those fears. Mindfulness will help with this one. But also, you can go and do other activities. So when you're triggered into an obsessive round of thinking about something, go for a jog. Go for a walk, make a phone call to a friend. Other things that might distract you from thinking about that. Any sort of behavioural based activity that involves you investing your attention in something is useful to take you away from the internal fears and dialogues. Anticipate those OCD triggers. Think about how you might manage your day in a more healthy way, for example, how you might get help around certain types of behaviours. Maybe you've noticed that it always happens in the morning. Can you change the morning, the way you do the mornings? Can you change the way you go to sleep, for example? Maybe you have something on tape that is soothing and comforting, a meditation that says nice things to you, so you don't have, so you wake up with that type of memory inside you. Challenge obsessive thoughts. It's cognitive reframing there. Have a look at some of my other sort of videos on some of those techniques around cognitive reframe, using thought records, checking out the reality of any of your sort of anxious or catastrophic thoughts, looking at how you can balance that based upon an objective assessment of reality. And then you may want to consult a therapist about it, somebody who is qualified and experienced in the field, somebody like myself or somebody else who can help you, guide you through the steps of the types of therapy that will work for you. Things to look out for is that your therapy should include exposure, as I said, exposure therapy, to regular exposure to these thoughts and feelings that you have, to allow you to experience them in a safe, contained relationship with a therapist, in a professional relationship, so that you get to manage the anxiety and give you practical tips on managing anxiety in the sessions. It should also focus on postponing rituals rather than jumping into rituals. So techniques that you can use to stop yourself from acting out unconsciously on these rituals, which actually are, and this may sound counterintuitive to you, but the rituals you choose will reinforce your fear. They don't really reduce it. So it's looking at how you stop that, and you tolerate the unknown, you tolerate being able to feel feelings that you're trying to avoid, and use other healthier strategies such as reaching out to friends and family or support groups. And your therapy should also, in terms of cognitive restructuring, teach you to accept thoughts rather than try and reject them or hide them or run away from them. To learn how to look at your thoughts in a more mindful way, and not invest in the reality of them, but to develop what we call the observer position with our thoughts and feelings. So that's really what you should be looking for. If you have a chat with somebody, ask them if they know about this sort of stuff. If they don't, they're probably not going to be that much help for you. So I hope that's useful. Slightly longer video, but I wanted to go into it because OCD can be incredibly difficult for those that suffer from it. But the headline here is that we know a lot about it, and we can get a lot of help for you around that. If you're, or somebody you know is suffering from those types of issues, do give me a call if you want to talk more about it. My number is 07506 319 745. That's 07506 319 745, or email me info@noelmcdermott.net. Thanks for joining me today. Please do leave some comments at the end of the video, or if you're watching this on my website, leave the comments on the website. It'd be good to hear from you, or you can just email them to me. I always find it useful to get feedback on whether or not these videos are helpful. Check out the website. There's a lot more information on sort of things you can do around this, self-help things that you can do around this. Thanks for joining me. I hope to see you again soon. Bye-bye.